Hello, everyone. I'm Keith Padgett, the Academic Program Director for Columbia Southern University's undergraduate fire and EMS degree. We're glad to have you, everybody, with here today. My special guest and presenter is Dr. Sara Jahnke. Dr. Jahnke completed her doctorate in psychology at the University of Missouri and is the principal of the Center of Fire, Rescue, and EMS Health Research. Welcome, Dr. Jahnke.
Thank you. Honored to be here.
Sara, can I call you Sara during this presentation? Will that be okay? You're not going to beat up on me.
Definitely. Definitely. I'll call you Keith. You call me Sara.
That's good. That's good. Well, Sara, I appreciate you taking time out of your busy schedule. I know you're in high demand around the country. The research you do is wonderful. So again, thank you so much. Sara, I know that physicals for firefighters is a hot topic across the nation right now. I know the International Fire Chiefs Association, as well as the Safety, Health, and Survival section, have created an outstanding document, and I know you played a key role in that, a health provider's guide to firefighter physicals. Can you kind of give us a little bit of background of the document and how it was created? And I'm also FSTAR in their involvement.
Sure. So the Safety, Health, and Survival section put together this document. One of the things that we were hearing from around the country was that we have some providers in instances, well, actually, kind of a variety of providers that are giving firefighters physicals. We have some who are amazing and know NFPA 1582 inside and out and can provide, really comprehensive physical. But unfortunately, there are a lot of departments that don't have access to that. And then there are a lot of firefighters who don't have, believe it or not, access to physicals through their department at all. And so the guide was really developed to kind of distill out a lot of the health and wellness issues for the fire service, so firefighters could take the guide to their own provider and talk to them about kind of the risks of firefighting. Because it seems, kind of basic if you want to get released for duty or you're talking to someone and, they're like, well, what is your job? Well, mostly I just drive. The reality of the fire service is that everyone has to be ready for anything at any moment. And so that's kind of a different picture to give to a physician. And so the guide was designed around that to help physicians and providers understand, whether they're doing department physicals or individual firefighters physicals, really understand what firefighters are facing and what they need to be concerned about and what they need to be looking at. To be aware that if you're seeing some kind of funky numbers, there are firefighters are at high risk for cancer. If you're concerned about something, being more proactive about screening. So that's what the provider's guide's for. It's been really well received by the provider community and the fire service in general. It's available online, also through the FSTAR website. So FSTAR was designed with the idea being that there's a lot of research going on in the fire service, and it's sometimes a challenge to get research from kind of the basic to the street and into the hands of firefighters. So that's what FSTAR was designed to do. It's an online resource, and it's really amazing the work that's gone into kind of cataloging all the research on firefighter health. Someone told me one time that that the majority of research, that we've done more research on firefighter health and wellness in the last 10 years than the 100 years before that. And I thought maybe that was just a made-up number. And so I actually looked at PubMed, which is the repository for all medical research, and it was legitimately true. About 70% of the research on firefighter health has been in the last, really since FEMA started funding firefighter health research. It's really kind of kicked that off. And so the FSTAR approach is that it catalogs everything that's out there, and it's really easy and really user-friendly to search. The other thing they do is they'll take studies. Sometimes they'll have the investigators do a summary. Other times they've worked with folks out in the field and really distilled it down to what the most important things are to do. I mean, I'm not going to lie, even as a researcher, a lot of the research that's out there is really dry to read the whole content of it, and so they've distilled a lot of it down into kind of one-pagers with a great application section for, like, what does this mean to you as a firefighter? What does it mean to you as a chief? What does it mean to you as a company officer? So that resource is out there too, and I think especially for anyone in school learning about firefighters and firefighters' safety and health, it's a fantastic resource to go to for kind of all the things that you need.
Sara, to wrap that up, I think that the one piece that I found on there is how to read research. I thought that was an excellent article and presentation for you, just to show firefighters of how to filter through some of that. Great work. Thank you.
Oh, thanks. I actually forgot that was on there, but yeah, we tried to kind of just put together like a quick and easy, what are the parts of the article, what are you looking for? If you want just the quick and dirty stuff, where do you go for that? And then what are some of those things mean? Because really, like, research is a different language in a lot of ways. So we tried to distill that out to where it makes a little bit more sense, makes it a little more user-friendly.
Sarah, on the last slide, you touched a little bit as firefighters as tactical athletes. What do you mean by that?
Well, it really means that firefighters are not just another, firefighting is not just another job out there, right? So my job in a day-to-day is to pretty much sit at my desk and type things. If you think about what most people do in their day-to-day life, it's sitting on the phone, typing things, things that are not really taxing. But for firefighters, we know that serving in the fire service, responding to calls and responding to fires in particular, really puts a stress on every system in your body. And so you have to think of it in terms of being prepared to respond to those emergencies. You pretty much have to prepare like you're an athlete. If you think about the way that athletes practice for games, and before they go out on the field, they're doing their stretches, they're doing all those things. Unfortunately, you're not going to get to a fire where you're going to have time to stretch out and kind of warm your muscles up and get ready to go fight the fire. So really, you have to think in terms of how can you get a tactical athlete mindset? How do you prepare your body? How do you, there's some great literature that's just come out about you really do need to train like you're going to work. Your body needs to get used to that. So really, when we talk about firefighters as tactical athletes, it's that. It's realizing and appreciating that every body system is going to be taxed by responding to a fire, responding to an emergency event, and then training for that, basically, and understanding the importance of that.
Sarah, normally when I go to my physician on my annual physical, is a biometric. Kind of really basic, blood pressure, vitals. He'll ask me a few questions, so a checklist, but this is a little more in detail. What all's on this?
So this is just some additional things that physicians want to think about. And one of the things with the guide is to realize we're not trying to tell any individual physician exactly what they have to do. And it's always dependent on what insurance will pay for and all that type of, all those types of issues. But really the guide points out to these things on the examination checklist to make sure that it's being brought to the attention of the physician. If you think about a lot of physicians will kind of clear people or, do their annual exam, and they kind of think of it in terms of, it's not really that much different than like clearing your 9-year-old for soccer. But the issue with firefighting is it's sometimes a little bit different than that. And your physician may or may not elect to do all of these screenings, but they're things that are brought up and that the expert panel really felt were things that physicians needed to consider and think about as screening tools. So it's not a standard in terms of you must do this or a thou shalt do these things, but here are the things that we recommend you consider as a checklist and realize that, firefighters are going to be in taxing environments. They're not the average person who is relatively sedentary. They're going to be responding to calls in heat with 70 pounds of gear on them. So these are some of the screenings that the panel of physicians that developed the guide came up with that they thought were useful screening tools.
As we've all heard, the #1 killer of firefighters in line of duty deaths is heart-related. If I go to my physician and talk with him about cardiovascular, what are some of the items that I should ask about and point out?
It really was with the physicians that because we did an evaluation of this, and one of the things that was really startling to a lot of them was that the leading cause of on-duty death for firefighters was cardiac-related. People assume that firefighters are dying because they're falling through floors or roofs are falling on them, things like that, or smoke inhalation, which happens, but just not as common. And we know that the fireground is the perfect environment to induce a cardiac event in someone who has underlying risk factors. And so really the importance of this and paying attention to this is knowing your risk factors, so being really very aware of your health. And with a lot of this too, it kind of puts the onus back on the firefighter to pay attention to their own health. If you're feeling different, if you're not feeling good, you do need to go get that checked out. If you're someone who, and thinking about like all the cardiovascular risk factors and things like cholesterol and body composition and diet and fitness and nutrition. Those things are all important and even more important for firefighters than they are for the general population. So, and it's with the guide and for firefighters and for physicians, it's really highlighting the importance of being aware of cardiovascular health with the understanding that you're going to go into pretty much the most taxing environment that you could imagine. That's the perfect storm for a cardiac event.
Sure, I think there's more and more of us that realize that we have firefighters that have retired that have cancer. How can we work with our physicians to hopefully prevent that?
One thing is definitely being aware of signs and symptoms in your own health, kind of like what I talked about with cardiovascular disease. And if you notice a change in the way you feel and the way you kind of operate day to day, it's similar with cancer. If you're paying attention to things like skin cancer, checking your body for issues, if you're not feeling good, making sure that you follow up with a physician more instead of just kind of waiting to see. Unfortunately, there have been a lot of instances where I've worked with attorneys getting coverage for firefighters, and a lot more often than not, the story is they really didn't feel good for a long time. Sometimes even that they went to their physician and kind of didn't have an answer. And so I think part of the focus needs to be being aware of the increased risk of a lot of these cancers. And so you are aware when things seem to be not adding up to screen for cancer earlier. We know there are challenges with too many cancer screenings. Sometimes you can get false positives and things like that. And so that's, the other side of the coin. We don't want to go ahead and do invasive screenings for every type of cancer because that puts people at risk too. But really, paying attention to your risk factors, paying attention to what other risk factors beyond firefighting you have, and knowing those, and then also minimizing the risks that you're facing. So we know that on the fireground, there are chemicals that you're exposed to that you breathe in, and we also know that there are ones that come in through the skin, especially where there's been some great work looking at where carcinogens are getting in, and it's pretty much anywhere where gear's coming together. On the neck, a lot of times there are hoods that are being developed that are designed to keep chemicals out, but making sure you clean your hoods, making sure you decon. There's great data now on the importance of doing gross decon on the fireground and how effective that can be, and just reducing exposures in general too. So not carrying your gear inside your car, not making sure your gear's clean. It used to be that it was really cool to have a black helmet and dirty gear because that meant you had really seen a lot of stuff and seen a lot of fire, but now that's, shifting, hopefully in most places, not all places, but most places it's shifting to where that's a lot less cool than it used to be. And just being aware also of the other risk factors even beyond that. So if your family's at high risk for a certain type of cancer, you have a first-degree relative that's had a cancer, be mindful of that. And really with the cancer screening, and it's similar to the cardiovascular screening. So, again, we're not saying you need to go in and tell your physician, you will do X, Y, and Z. It's bringing it up like a risk factor, like anything else. If your family has a high rate of testicular cancer, your physician asks often, do you have family member, a first-degree relative with these types of cancers? And it's understanding those risk factors and then explaining to your provider, that you also have these additional risk factors. You are ingesting on the fireground things like, PAHs and benzene, and paying attention on the fireground and thinking through how you can limit those, but then also being aware of and finding cancers as they come up early. One of the things that we know is that early detection, your survival 5 years out is markedly different if you detect early in the early stages of cancer.
You mentioned a couple of slides back that fireground injuries appear to the public as our #1 cause of line-of-duty death, but that's not the case. However, there are multiple injuries all the time on a fireground. Tell us a little bit about that and the prevention.
Yeah, so musculoskeletal injuries, so those strains, sprains, those tend to be the highest rate of injury in the fire service in general. And we know that, the fireground is an intense and dynamic work environment where, you can't necessarily train for everything you're going to experience, but you can train as the best you can. We know that low back injuries in particular. And so a lot of these things go back to kind of some of the basics about proper lifting techniques. And, you're not always going to be able to be in exactly the best position to prevent these injuries, because it's not, not always a flat, clear ground where you can fully, crouch down with and bend, lift with your legs and not with your back. But doing the best you can. And the other thing with this that's important is prevention. And prevention is really focusing on fitness. It's, again, training like you're going to work, doing those dynamic exercises that are going to build the muscles that when you can't do 100% proper lifting, you will be able to do at least 99%, but your muscles are used to that. So that's really the key with musculoskeletal injuries, is paying attention to prevention and training your body to prevent injuries.
One of the things that we probably at times don't want to talk about in the fire service, or maybe with our physician, could be behavioral health. Whether we went through a phase of depression or just have anxiety about shift work and dealing with other life problems. Let's talk briefly on that.
Yeah. So in terms of inclusion in this, the thought behind it and what we got great feedback on from physicians was that it gives the opportunity for the provider to bring it up. And that was one of the big pieces of feedback we got was, wow, it's really nice to have that there because it is kind of a springboard. Physicians in general sometimes have a hard time talking about behavioral health and talking about, how are you feeling, how's your mood, because they're not trained as therapists, right? So they're trained to primarily address physical health. Not that there aren't some out there that do a fantastic job, but we definitely thought that this was important to include on here because we do see the fire service being a really stressful environment. So you have those acute exposures, so like a line of duty death or a particularly bad call, but then you also have the kind of chronic stress from the repeated exposure to trauma, and then you also have the stress that being a firefighter puts on life in general. The fact that more firefighters, you see elevated rates of things like depression and anxiety in the fire service, and we thought it was important for providers to know that. But the fact that given everything that firefighters face and the fact that they're on shift, a third of their lives, and so they're missing a third of their families' lives, and shift work in particular is bad for pretty much every part of your mental and physical health. The fact that more people aren't struggling with this, it really speaks to the resilience of the fire service. But it is important to check in with the patients for their provider. It's important that firefighters are checking in with each other. It's important that as a fire service we are all okay having the conversation, because often we're our own worst judges of where we are in terms of mental health. And so kind of self-evaluating and having that check-in with someone, having the provider ask some questions about like, hey, how are you handling this? Because being in the fire service is stressful, acute stress, chronic stress, and then the stress of, the impacts that has on family. It's a great thing to be in the fire service family, but, you are going to miss a third of the birthdays and a third of the Christmases and a third of the Thanksgivings. And a lot of times that has an impact. And being exposed to all the things you're exposed to kind of adjusts your kind of the emotional availability you have for other things going on outside the fire service, which can have can be stressful for firefighters. So it's really important, whether it's with a primary care physician or a therapist or whoever it is, that people are aware of these things. And then kind of the implication or the next step of that is alcohol use. We know from the data on alcohol use in the fire service that rates of binge drinking and heavy drinking are extremely high compared to the general population. And unfortunately, those have health implications too. Binge drinking increases risk for things like cancer and cardiovascular disease. So being aware of that, kind of checking in and doing some self-checking and checking in with a provider is an important thing to do, just so you're aware of where you're at, basically.
The self-evaluation is vital. I believe there's no normal routine type life for the firefighter. So having that third eye to kind of say, where you're at, how are you doing, I think that's critical and something that everyone should do, because we just don't, sometimes we just don't see it. So I appreciate that. Sarah, when we talk about lung disease, what always comes to my mind is I had an old battalion chief years ago that actually died from COPD. And I always think of him and think about the smoke and the carbon monoxide or whatever that he breathed in as a younger firefighter. But we've moved away from that and moved to, hopefully, everybody's using their SCBAs and not breathing smoke. But still, we have a lot of exposures at some point, and that might be overhaul. What's your comments?
Well, so there's some interesting data that's come out of the work that, like Denise Smith and Gavin Horn, the folks at Illinois, the UL folks have done, looking and what exposures were. And, you know, where it used to be, well, at one point in time, people didn't use SCBAs, like you mentioned. And it's, you know, hopefully now in most places a little bit more commonplace. But, you know, typically, even in some of the more progressive departments, like, and I've not fought a fire, so I say that first of all, but from what I understand from what Dad says and everyone else, it's not, SCBAs are not really a comfortable thing that you enjoy wearing while you're working. But the problem is, you know, often now it's like, okay, well, when we get there, when we go and do an interior attack, and then once we come out, then we take it off. And often during overhaul, people aren't wearing them. What the work's showing out of UL and the stuff that Gavin and Denise are doing is that there are carcinogens that are present often when the air looks like it's clear. So where it seems like, and you know, you can monitor for things like carbon monoxide and, you know, hydrogen cyanide, but there are other things in the air that are not being monitored for. So sometimes even when the air is clear, there's still these microparticles that are getting in, and the problem with that is that because they're so small, they get in so deep, and it's, you know, this intense exposure, but a very small particulate that gets deep into the lungs. So that's the concern with lung disease, and then also recognizing that in the past, that was not the experience, that people, you know, for years didn't consistently use SCBAs. But if you think about all the stuff that is, so they have years of bad exposure. And if you think of all the stuff that you're exposed to, both on the fireground, you know, we have the changing fire environment with pretty much everything being made of some sort of vinyl now, and, you know, dumpster fires and all the things that are out there, car fires, and everything that is in the air. And sometimes you think that it looks clear, but it's definitely not clear. So that's the concern there, is really being aware of that, and then also realizing, like on the fireground, sometimes you're exposed. The study that Gavin and Denise did up in Illinois, they found like plumes of area where they were measuring really high levels of benzene, and they realized it was because of where they parked the trucks when they came to respond to the fire. And you know, and it was upwind, and so there were, you know, people were standing in basically a cloud of diesel exhaust. So all those things, you know, really can affect lung functioning and can cause some problems.
You know, we were using a multi-gas detector at some point, going into a large room where there might be, let's just say it's a residential structure, and had a fire in the kitchen and it spread to the living room. And then we would, during the overhaul, all the SCBAs would come off. We would take a multi-gas in there, take a reading and say, okay, it's pretty good. Standing in the middle of the room where there was a lot of fresh air being blown in by the PPV, and then we put our guys to work overhaul. And then they would work in confined spaces, as a hallway or a closet, and which, you know, the carbon monoxide was over the roof then. So, you know, go ahead.
Yeah, and even, well, I was going to say that arson, the organizations that, you know, really represent arson investigators are now recommending that, you know, they say if the fire's been out for 72 hours, you're probably okay to not, you know, not wear protective respiration type tools, but even then they describe that there are pockets of gas that can get out after a fire. I mean, you know, and that's the problem with the post-incident, is that you don't know where those, you know, you don't know where those gases are, and you're monitoring what you can monitor. But one of the things that I think is really clear from the UL studies is that there are things that no one ever thought were there before,
sure,
that are there, so we're not monitoring them.
Okay, sleep disorders. We had, I've got a little quick story with this. Knew a firefighter that worked a second job, got off from the fire department the next morning, got in his truck, had to drive like 45 miles away. He fell asleep at the wheel. took his truck, bounced off the inside of the retaining wall because he'd been up all night long on just a 24-hour shift. And I know that some departments work 4896s, but he luckily didn't injure himself and or just a little bit of damage to the truck. But this is a major concern that we think that we can overcome relatively easy. I don't see that.
No, the research on shift work and pretty much any health outcome, like I said earlier, any physical or behavioral health outcome is not good. Sleep, the importance of sleep is that it develops or it runs the circadian rhythm, so the pattern that your body goes through, and typically controlled primarily by being exposed to light. And so, it makes sense that like developmentally and that you have that cycle that goes day and night. You're out in the light in the day, you're not in the light at night. And so we know that shift work, and there's great data on other groups like residents and mistakes that they make and nurses who work nights. The fire service data is kind of coming on. It's a little bit harder to do because of so many different types of shifts. But the data that's out there is that it has a negative effect, really. And if you think about any department, any given department, because the question always comes up, like, is a 4896 better than a Berkeley schedule or a 2448? And the challenge with any department is that you have busy stations and you have not busy stations. And so you always have to kind of plan for your workstation. But another challenge of that is that you see high rates of sleep disorders in the fire service. I think the data suggested it was somewhere between 40 and 50% of firefighters had sleep apnea, not diagnosed with sleep apnea, but were exhibiting signs of sleep apnea. But you also see high rates of things like restless leg syndrome, where your legs basically wake you up because they're moving while you're sleeping. And the challenge with that and the sleep issue is, you do see increased risk of things like accidents, cardiovascular disease, diabetes. It helps. It can hinder behavioral health and increase risks for depression and anxiety just because your body never gets really into that rhythm. So it's constantly interrupted. So it's a challenge. I mean, I think you look at anyone who comes off the job or retires from the job, and even then, when you've conditioned your body to 25 years of being up every third night, or unfortunately for the volunteer fire service, I grew up where we had a scanner in our house but going day and night. I mean, for volunteer firefighters who are never off duty, it can sometimes even be a bigger problem because there are no off nights where they can sleep in. And I know that a lot of them talk about that even when they're on vacation or out, they just don't sleep well. So it has some serious implications, and it makes the importance of addressing sleep disorders just that much more important.
You covered it. There's a radio that sits on my nightstand right now, and I consciously listen to it. I say unconsciously listen to it all night, every night. And I'm listening out to make sure that if they need resources or do they need some help in another form. So I guess I have an issue with that too. But I mean, it's when I've done it for the last 37 years. So it's normal to me, and as we were talking about normal situations a little while ago, it's the fire service overall. Okay. Sara, infectious diseases are something that I'm kind of familiar with, of course, being in the fire service, but I had a close friend who contracted Hep C from a motor vehicle accident and was confirmed, and it eventually took his life after he retired. This is an issue that we need to all focus on. But what's your thoughts and what was the research? Ideally,
no one would get any of these infectious diseases, and the best case scenario, everyone would be protected all the time, but we know that doesn't happen. And, like you talked about your friend who came up on an accident, I mean, using universal precautions whenever you can, but then also, knowing what you're exposed to and monitoring and making sure that you're getting checked for the things that you could be exposed to really is the kind of take-home message to this one.
Okay, wrapping up. I put NFPA 1582 and the IAFF and the IFC Wellness Fitness Initiative up here, just so we could briefly comment on those. But I think if the average firefighter walks into his doctor's office and recites these, the physician is not going to understand what he's talking about. How can we help that person communicate that to their doctor?
Yeah, I'll be honest, and this is no disrespect to the people who write 1582, but it is a long and cumbersome document. And it really does outline the details of every system in the body. And not every physician needs to know about that, but it is important, especially if you're having some sort of health challenge or you know, having some weird symptoms, to be aware of what's out there in 1582, because it really does cover everything, and it covers everything well in terms of recommendations for screening and things to consider. And then the Wellness Fitness Initiative is an awesome resource for firefighters, and you know, most providers won't pick that up, but I think firefighters should be aware of what's out there and the recommendations in there, and then work with their physician to reach some of those, especially when you look at things like, you know, fitness and wellness and overall health and wellness. You know, work with their physician to reach those goals of basically being as healthy a tactical athlete as they can be when they go on the job.
Okay. All right, perfect. All right, well, that kind of wraps up the formal presentation, but we want everybody to stick around for a few minutes. We're going to have a Q&A section and with Dr. Jahnke, and she'll be here to take and answer all of your questions in just a second. Okay, Sarah, it looks like we got a handful of questions here. David asked, what additional tests do firefighters get, such as a PSA test?
You know, there's not a special test beyond what is already out there in terms of tests, but what is being recommended is that physicians be a little bit more aggressive in making prescribing those tests and having people get the tests taken, especially if they have some sort of adverse health issue or having some sort of health problem. So it's not, you know, if you look at the provider's guide, and there's a link through the F-Star that you can download it. If for women, it's things like a pap smear and mammograms. Some of the recommendations are that those be done a little bit earlier than you would typically do them, because we do know from a lot of the data that firefighters tend to get these cancers at an earlier age than the general population.
Okay. All right. Nicholas asks, with the general health and wellness being a contributing factor of cancer and firefighters being in terrible shape across the country, is it a Band-Aid to do all these carcinogen reduction measures, more people, extractors, etc., without addressing the general risk factors like fitness?
Yes. Was that a good answer? Actually, so you are absolutely 110% on the right track. And one of the things that we've been really kind of working to raise awareness about, but it's a slower process, I think, than the other topics about like being on the fireground. But really, if you look at the risk of firefighting and kind of across the board, firefighting is bad for your health. So it is the carcinogen exposures, but it's everything else besides that. It is, you know, the challenges with fitness. We do know that there are higher rates of overweight and obesity in the fire service than the general population, likely due to a lot of occupational risk factors, everything from kind of the inconsistent eating habits and some of the cultural traditions around food in the firehouse to, you know, a lot of firefighters can't or don't make time for fitness. So that's a challenge too. And sometimes, you know, it's with the best intentions, but, you know, you get ready to head to the gym and you get a call, and then it pushes everything back. You know, around, if you think about just the food environment in the firehouse, I mean, you're always, I think Murphy's Law says you're always going to get a call when you have the very best meals out and hot on the table. So, you know, you eat fast. I grew up in a big family. You eat fast and often, and you eat as much as you can because there's not going to be a lot of leftovers a lot of times. So there are a lot of things like that that I think contribute, and I definitely think that those need to be a focus. Alcohol use in particular, you know, given the rates that we see in firefighters of the rates of binge drinking and heavy drinking, where you see like a 10 to 15% increase in risk for cancer among firefighters, probably related to carcinogen exposure. Some of the risks for, if you look at like binge drinking, you'll see like a 400% increased risk for binge drinking and development of cancer. And so, yeah, I think carcinogen and the fireground exposures are important, but I think the big picture health and wellness is what we really, I personally believe it's what we need to get back to, because you can really mitigate a lot of the risk, a lot of the risk off the fireground, even more than you can on the fireground.
I'm just surprised Nick knew that I was in such terrible shape. Nick, we appreciate it.
No
Jason
pressure.
has a question. Yeah. Do you feel that genetic testing is valuable in testing for personal risk?
I do. Now, so there's been some debate in terms of, like, some people have said, hey, should we do this pre-employment? I think it's a slippery slope when you look at it in terms of a department doing it, but I think knowing your personal risk is a great idea, just because it makes you more aware. You know, I mean, if you think about, like, you have the gene that has an increased likelihood of breast cancer, well, then you should be more careful about doing your self-breast exams, and, you know, same for testicular cancer. And paying closer attention to it. So I do think that there's enough evidence that those, you know, just because you have the gene doesn't mean you're always going to get those types of cancers, but it makes you, I think it increases your awareness. And there's some, like, relatively inexpensive tests out there that you can do that, your own self-monitoring. And I think it makes you, you know, like I said, it's not 100% you're going to get those cancers, but if you're at higher risk, you pay closer attention, I think. You know, my family, we don't tend to die from cancer, but we do die from cardiac. And so I pay a lot closer attention to my cardiac health, and have had some additional screenings compared to what I think someone else my age would. So yeah, I think at a personal level, I think it's a great idea. I think there's some risks if you look at it in terms of, like, any type of employment or insurance thing, but I recommend it. I've had mine done, and it's been helpful.
Okay. Michael has a question. It says, I sit on the Health and Safety Board for the International Association of Arson Investigators, and we recently published a white paper recommending best practices for PPE usage for fire investigators. Have you included any fire investigators in your past research studies?
I loved your report, Michael, so thank you so much for that. And I recommend that anyone on this and listening to it read it, because I thought you did a fantastic job on it. In fact, I was reading it 2 days ago, flying in a plane, and I've had 3 or 4 people since it first came out. So it's getting out, and it's definitely being noticed. So in terms of research that's gone on, none of our research has been particular to investigators, but there is work being done on it. So a cancer cohort, the prospective cancer cohort that's going on, originally Jeff Burgess's group out of Arizona, and then added on Alberto's South Florida. We just got funding on that. I think we got notification last week, and that adds in specifically investigators. So understanding more about those exposures, and I think we're going to have some good data from that. So I know that's in the works. It's not been something that was really paid attention to before, but you guys did, and I think you guys did a great job raising awareness about that issue with that white paper. It was fantastic.
Okay, Michael, thanks for your question. Doug has a question.
And for your work.
Yes, for your work as well. Doug states that his area uses CO alarms in their medical bags, and is this a common practice around the country?
And Keith, you might be able to speak to this better than I can. I have not heard that as common practice, but I think it's a great idea.
No, I do too, and I was if you had heard anything, because I have not. But I do see the value in that. Maybe some of our attendees can kind of comment on that as well. I'm not familiar with that, but I mean, it makes perfectly good sense, though. One follow-up
Yeah.
from Doug is an annual replacement of Nomex hoods is their policy. What's your recommendation on the annual replacement of Nomex hoods?
So we've had a lot of departments that have started replacing those, looking at them as something that's just disposable and replacing them actually after every fire, which I realize gets expensive and not every budget can allow that. And then, the other side being that they are making new hoods now that should protect against particulates. They're testing them to look at kind of the cardiovascular impact and the rise in core temperature from totally encapsulating, especially around the neck. But I would say even if you're not replacing those really frequently, definitely washing them. I know there are some campaigns to do like Wash Your Hood Sunday and things like that. I would definitely encourage those to be washed on a regular basis, even if they're not being replaced.
True. I know there's a local department in Atlanta, DeKalb County Fire, has set up a program that when they have a large fire, that they send out Nomex hoods to that company immediately and gather those up to be deconned and washed and cleaned up. Of course, they try to put all their gear in extractors as well. So good question.
Yeah.
Steve asked, how effective do you feel baby wipes are for cancer reduction gross decon as compared to hero wipes or similar products? I guess he's comparing
that.
Go ahead.
Yeah, no, it's a great question, and I don't have a great answer to it because we haven't studied that yet. So I know there are a couple of different products out on the market. All are a little bit different in the way they're constructed. I can tell you that I believe Gavin's study and Denise's study out of Illinois found a 64%, I believe, but I might be off on that a little bit. Basically, a significant reduction from the use of wipes. Now, I asked Gavin what they used, and they did use baby wipes in that study. We've talked about kind of looking at the relative benefits of the different types, but nothing has been designed for that yet. So I think it's important to clean off. I know, soap and water is always always a good fallback if you've got that too. But we don't have great data on that. Hopefully, if you ask me that again in a year, we will. But I think wipes are good and are important, but relative, baby wipes versus the bigger wipes, I don't have an answer for you.
I just think as a part of gross decon, even if you only can have baby wipes and get them across the department, it's better than nothing. So at least you can get a quick gross decon on site. Thomas has our physical conform to NFPA 1582 guidelines. We have begun recommending colonoscopies for the firefighters above the age of 50. Due to the high incidence of colon cancer. We've been met with some resistance due to cost and the procedure. What are your thoughts on this additional screening? And I'll comment on that briefly. When I turn 50, I'll have one as well. No, when I turned 50, I began that process. Now that's the recommendation of my physician. So, Sarah, what's your research?
Yeah, that's you guys are hitting on all the really great and hotly debated topics on this. There is so after the provider's guide and while developing the provider's guide, there's a lot of discussion around this because there is risk with any screening test you do. I mean, there's a risk of a false positive even on the most simple ones, and then are you doing more invasive screening, and then the risk with those invasive screenings, and and who really wants a colonoscopy in the first place. But with all that being said, I would say you've got to talk to a provider that you really trust and see where they're at, because there are a lot of physicians that really expressed a lot of concern about the recommendation of additional screenings beyond what 1582 has recommended or what 1582 does recommend. I know there's been a lot of discussion and thought that goes into what 1582 says. I know I'm kind of dancing around because I don't have because there's not really great data, honestly, on, again, where there's, I talk about all the research that's been done in the fire service, but there are a lot of questions that remain unanswered, and there's not great data on how many false positives we get. I would say specifically for anyone who has that who has other risk factors for that, including like a family history, because that's related, I would be more aggressive about that screening, but I also understand the concern about and think it's justified to, not over-screen for some of these things.
Yeah, that's why I mentioned, my personal physician, he made the recommendation for me to do that. So, but I do know that there's a lot of discussion on that. Brian has one. Any suggestions on supplements or lifestyle changes to help with sleep deprivation? Looking for the recovery of adrenal fatigue that's not happening without getting into deep sleep. Also, your opinions on shift change time for 48 or 24-hour shifts, 7 a.m. versus 7 p.m. Maybe a pro and cons is what Brian puts here.
That's actually the first time I've ever had. I always get the 24-48, but that's the first time I've ever had that question on time of day, and so I don't have an answer for that. I know there's no research on it.
Yeah, I've worked 24-40 my entire career, and then the relief time has always been 7 or 8 in the morning, and then was relieved at the next morning at 7 or 8.
Yeah.
What about supplements or lifestyle change to help with that?
I think that in terms of lifestyle change, I think sleep is just so important, and I think you have to be really on top of getting the best sleep that you can. I mean, the fire service is going to interrupt to that, but I think all the sleep hygiene stuff around, a cool, dark, relaxing place, and not having, there's some data coming out about like screen time and even the blue light from your phone interrupting that in some way and interrupting the rhythm. So I think all the stuff around sleep hygiene is important. I think making sure that you're not dealing with any type of sleep disorder, because we know that a lot of firefighters struggle with sleep disorders. There are a lot of recommendations in terms of sleep concerns around alcohol use not being good, even though it does sometimes put you to sleep and or you can pass out from it if you drink right before you go to bed. Not that I'm recommending that, because actually it is found to be related to worse sleep overall. So paying attention to those types of things. In terms of supplements, there's nothing in particular that I know of. I know, there are, like, melatonin can be really effective. You just, I think, don't want to get into the pattern where you're always having to take something to get to sleep. But overall, just kind of supplements, we know that you get better sleep if you're in overall good health. So the supplements that I know are showing some really great data are kind of like the gut health, probiotic, prebiotic things. And, focusing on making sure that you have, you have in terms of lifestyle, like an active lifestyle to where you are worn out at the end of the day. But yeah, that, and I think alcohol use is really a big thing. And then, paying attention to caffeine and when you're drinking caffeine and consuming caffeine and how much. So those are, I think it's more around lifestyle stuff. But that's a great question about the shift change. And I've definitely never seen any data on that, but it's a great question. I shall add that into my list of research questions.
And I haven't heard that as well, but on a part-time job years ago, I had a job with a company that required me to show up in the evening. There was anxiety waiting to go to work, and I'm not sure if that kind of factor. I felt like I was always waiting to go to work. When working for the fire department, I got up in the morning, took a shower, put my uniform on, and headed to the fire station, and that began my day.
And then did it.
Yeah. With that question, I want to know: is there something? Any of the studies have said anything about naps during the day, trying to catch a 20-minute, hour nap, something like that?
Naps can be incredibly useful. And caffeine, I warned away from caffeine earlier, like as being a sleep interrupter, but one of the best ways that I'm aware of from the literature to use caffeine is if you are going to be up, you want some restful sleep, do like a cup of coffee, take a 15-minute nap, and then when you wake up, you have the kind of added benefits of both the caffeine and the short nap. Napping, especially in departments that are going to be busy and stations that are going to be busy at night, is definitely a good idea. I know in some ways it seems like, well, why are we, there's a lot of pushback sometimes, why are we paying people to sleep? But if you're going to be up all night or more than, a time or two in the night, I think a nap and policies to encourage, especially brief naps in the afternoon are a great idea.
So you're going to have to write something for everyone that attended this today to say that we could take naps.
Like a note.
Yeah. Okay. Tom, would you recommend using ultrasound as a screening tool for firefighters?
Again, I feel like my answer to all of this is we don't have great data on that. I've been in conversations with the folks, some folks down in Florida that do the ultrasound, and they don't have the data on it for their specific group. So I know that ultrasounds have been used effectively in kind of the general population literature. One of the challenges with it is that its efficacy is largely based on the training and the expertise of the person doing the screening. So I would say that the use of ultrasounds, and we'll hopefully, because this has been one of the conversations we've had, is, we really want to get some good data on the utility of screenings and what is, how many false positives are there? Does the risk outweigh the benefit? Not that there's a risk necessarily to the ultrasound, but referring people on to additional screening they don't need can be risky. And the stress of having a positive test if it ends up not showing anything. So data hopefully will be forthcoming on that. It is a question that's getting some attention. In the literature, it can be an effective tool. And like I said, if you're going to get it, we know that it's more effective for people who are well-trained and do it often. So I would definitely prefer a site, if you're going to get it, someone who does that pretty regularly and has a lot of experience doing it. Because it's kind of a little bit more of an art than a science.
Understood. One last question. Johnny has asked, with the fire service knowing the leading cause of firefighter death is cardiac issues, when do you believe that nutrition will be added to the basic firefighter training program by the NFPA? Do you think they'll move to Go ahead.
Yeah, I wish it was yesterday. And really, if you look at overall health and wellness and the best things you can do to improve your health, and fitness is important, and, being physically active and training like you're going to work, all that stuff is important. But, if you really want to affect body composition, there's that saying like abs are made in the kitchen. Well, pretty much any weight loss is made in the kitchen. I don't know if and when it will be added to NFPA, but I think it should be something that everyone pays attention to. One of the challenges is kind of the recommendation, like, is low fat good or bad? Is fat good or bad? Or eggs good or bad? There's not, even within the nutrition groups, you have some argument. But I think there have been some studies that have looked at kind of general nutrition recommendations and what is similar across groups, whether it's Mediterranean diet or paleo or, grandma's diet from down the road. What we know is things like cutting back on processed foods, increasing fruits and vegetables, eating real food that with ingredients that what they are all important things. So that between that and hydration, and I think hydration is an easier thing for people to swallow and get behind just because they, I think everyone can agree on that, pushing water and making sure everyone's well hydrated, especially firefighters. But I would like to see that in there. I don't know if it'll make the standard, but I don't think that means it shouldn't be, a primary area of interest for the fire service.
Sure, I couldn't agree with you more. I think firefighters on average walk around dehydrated all the time. And
yeah, there's actually good data out there about that. And we just had accepted for publication a paper that looked at that, and we found that it was even, for firefighters who were in the obese category, it was even higher than it was for folks that were in the healthy range of body composition. Fun fact, right?
Yeah, that's true. All right. Well, that kind of wraps it up for us today on the podcast. Dr. Jahnke, Sara, I cannot thank you enough for taking time out of your schedule to be with us. Columbia, the people. Yeah, it was good. We enjoyed it. The people at Columbia Southern University want to thank you, and thank you to all the attendees that took time out of their day and attended the podcast. It's always great to hear from you, Sara, and again, thank you. All right, well, that wraps it up, everyone. Everyone, we appreciate you, and we'll talk to you soon. Take care.